right when you hear that. You know it's a Sunday afternoon. And it's time for Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05. By His grace, we're alive.
Joy 99.7.
Always a blessing to be here. So I do a little praise. And we get to the business of the day. A localized resurgence of COVID-19. My specialist will say SARS-CoV. So welcome aboard, and he is indeed our everything.
Joy 99.7 FM.
Jesus, you're my everything, yeah. My everything is you, Lord. Yeah. Everybody say, yeah.
Joy 99.7 FM. Joy 99.7 FM.
All the many things
you've done for me.
words are not enough.
Words are not
Yeah.
enough to say thank you.
So Lord, you are my everything.
You're my everything.
How can I express my gratitude?
How can I express my gratitude?
All the many things,
All the many things you've
Father,
done
you
for
done
me.
for me, yeah.
Words are not enough to say thank you.
So Lord, you are,
Lord,
you
you're
are.
my everything.
Say, I call you
I
Zion.
call you Jireh, Lord, my
I
provider.
call you
I call you
Nisi.
Nisi.
You are my
You are
God.
my
I
banner.
call you
I
Rapha.
call you Rapha.
Hey.
You are my healer.
Say, Lord, you are.
Lord, you're my everything.
I call you
Joy
Jireh.
99.7 FM.
Lord, my
I
provider.
call you
I call
Nisi.
you Nisi.
You are my
You are
God.
my
I
banner.
call you
I
Rapha.
call you Rapha. You are my healer.
Say, Lord, you are.
Lord,
You
Joy
are.
99.7 FM. Joy 99.7 FM.
That's right, he's our everything. Hey Mavis, long time I see you, chat. We'll hook up.
nothing enough.
Yeah, if you're hearing me, you're live on 99.7 FM, live on Facebook, YouTube, and now the other one's called X.
Joy 99.7 FM.
So yeah, let's run into it. A couple of days back, we got a cautionary notice from the University of Ghana, alerting us to the identification of cases of COVID-19 on the university campus. Those alerts were later confirmed. There were suspected cases and confirmed cases. On the heels of that, the university authorities, we got different notices from different structures. The health directorate, later the dean of students, and the Ghana Health Service has also chimed in. So we do have a confirmed localized resurgence of COVID-19 in 2025. Yes, here in Accra, and we are told that it is localized, that is restricted, at least for now, to the environs of the University of Ghana campus. Following that, university authorities have been quite proactive. They issued a directive banning most large or mass gatherings, social gatherings. This was copied to all groupings on campus. Later, there was some clarification that it wasn't all social gatherings. Lectures were to continue. Right, so on the heels of that, there's also been, of course, the, should I say, responses from our active and I believe ongoing surveillance and monitoring systems. So today I'm pleased to have, though normally when I have him there's trouble, I'm pleased to have Associate Professor J.H. Kofi. He heads the Department of Virology at the Noguchi Memorial Research Institute, which is part of the university. And then I will also have on Zoom Dr. Michael Owusu, also a virologist, a senior researcher with the KCCR, the Kumasi Center for Collaborative Research into Tropical Disease, I believe tropical medicine. If I mess it up, they will correct me. So, Prof. Kofi, you're welcome.
Thank you very much.
It's been ages, huh?
Yes,
Yeah.
I only come here when there are outbreaks.
When there are outbreaks. So you are the outbreak. But yeah, I haven't spoken to you directly or on air since, your plenty elevations. But you're now an associate professor in virology
That's correct.
and the head of the Department of Virology
Yes, please.
of Noguchi.
That's correct.
Okie dokie. Michael, can you hear me? Right, okay. We'll sort that. But Dr. Michael Owusu is in Kumasi. I've never.
Yes, I can hear you.
Oh, salute to you, sir. I'm still yet to achieve, an in-person interview with you, but you've been so helpful over the years. You're also one who comes in when there's trouble. How's Kumasi?
Kumasi is doing well.
Right.
Everything is going on well.
Okay.
Yeah, I mean, like my friend Kofi mentioned, we only hear about us if whenever there is trouble. So when there is trouble, we come in to engage on this.
Right, but it does mean that we are quite assured and confident knowing that you guys are part of what is it? Integrated influenza and COVID monitoring or surveillance. There's something like that, Prof.
Yes, I mean, there is an ongoing surveillance system.
Okay.
It's headed by what we call the National Influenza Center.
Okay.
And it's situated in my department.
Okay.
In virology department.
So essentially, I've brought the virus into the studio. All right. So let's confirm this for my listeners before we get to the specifics. And then we'll try to go wider and, should I say, match what we've heard, what has been discovered, what specifically it is, and match it with the precautionary measures that have been taken. Right, the reactivation of the response, the university's response system for COVID. We'll look at that. But so let's confirm for my listeners, Prof. So there exists an active, ongoing surveillance of influenza and COVID, despite the fact that it's now being de-escalated across the world, globally.
Yes. So it's we call the National Influenza Center.
Okay.
And basically what they do is it was set up as a sentinel surveillance system.
Okay.
In other words, we have a strategically selected health facilities to pick up influenza-like illness.
Okay.
And also severe acute respiratory infections.
Okay.
Mainly viruses. So now they scaled it up after 2020. After 2020,
all right,
they added other I would say respiratory infections to it. So COVID became part of it.
Right.
So now the panel is to test not for only influenza.
Okay.
They test for COVID as well.
Right.
So this is active and is ongoing, and it is in collaboration with the Ghana Health Service.
Okay.
Yeah.
Right. I did notice also a notice issued by Prof. Samuel Kaba Akoria, who's now head of the Ghana Health Service.
The DG, yeah.
Right, okay. Talking about wider vigilance and compliance with all the precautionary preventative measures across the country, despite the fact that we are talking about a localized outbreak.
Yeah, if you emphasize on the localized outbreak, then it sounds as if we have not been seeing the cases.
Yeah.
So this spike that we had.
Right, Prof.
In fact, over the country, we have been seeing cases sporadically.
Right. That's what I'm coming
2,
to.
3. But just around, let's say from April, I mean, it just coincided with the rainy season.
Okay.
So June, we started seeing spikes. And it happened in the University of Ghana.
Right.
Just around, the time that they had a major activity where we had a lot of people come together.
Exactly.
Yeah. So that is where the university just sounded a caution. I mean, they just brought out this circular.
Okay.
So that circular was what made people think that no, okay, we are having a resurgence.
Yeah.
But in actual fact, we have been seeing these cases first sporadically, but now we started having spikes, especially during the rainy season.
Okay. Right, Prof. Thank you for that. But that's what I was building up to. And there's a reason I've been emphasizing on localized.
Right.
You know, very often we sit in the media, we do a lot of research. Well, I do before I come on air. And I know I'm also a member of the university. You will get statements which are as if you've caused some panic or you distorted certain. So I've read everybody's statement from the Dean of Students, Prof. Rosina Chimanting. I've read the one from the Health Directorate, and then there was another one, and then there's the Ghana Health Service one, right? Because I know sometimes when people listen to radio, then they say, oh, I heard this, and they said this and that. That's why I'm emphasizing localized. Right. And I'm glad you've mentioned that, yes, we'll be monitoring over time, and we do get cases, right? And where they are significant and of concern, then action is taken, and then it comes into the public domain. Dr. Usu, let me just come to you. So we've confirmed to our listeners that, yes, we have been monitoring. You guys didn't go to sleep, all right? There's a system that is actively monitoring. And does it come to you as a surprise? I noticed in Professor Akorea's statement that, yes, he said, though this has been de-escalated globally, there will be cases and spikes from time to time. Can we say this is normal before we look at the type of cases we've seen? Is this expected?
Yeah, good afternoon. Good afternoon to you and your listeners as well this afternoon. So I think this is to be expected. And for me, it's a usual pattern of outbreaks of some of the normal respiratory viruses that you want to classify as seasonal respiratory viruses that often cause outbreaks like this whenever you have a cold or wet season or rainy season, as we have seen. So like Professor Bonnie just mentioned, I mean, there are a number of viruses that do circulate every year. And one of the risk factors for increase or surges in these viruses is cold, wet season when people are normally indoors.
Okay.
And the other is when people interact and
Okay.
find themselves in large gatherings or closed circles where they exchange either through engagement or practices where there is a minimal level of, precautionary measures.
Okay.
So normally at these times, one of the major viruses that you will expect is influenza viruses, which is one of the things that is tested as part of the surveillance programs. But these viruses cluster around many other viruses, of which SARS-CoV coronavirus 2 is part. I mean, at this level, we know that the virus has has become endemic.
Okay.
And therefore, it's not a new thing that is going to cause any form of
Essentially, we're living with it.
pandemic. Of course, we're living with it. It
Okay.
has become part of us. So at certain seasons, you will expect that whenever other viruses increase or rise up, this virus will also rise up along the line.
Okay.
Except that because we know that now this is one of the threats, which is COVID. So there's a lot of fear that once you mention COVID, you have a pattern like this. I mean,
Okay.
this is a report from the University of Ghana, but I want to believe that around this time, many people are experiencing flu symptoms from many of the other universities or some polytechnics. It could be some of the boarding houses across SHS, but perhaps we've not had the opportunity to test a batch of these people to understand what is going on.
Okay.
So I see this as something to be expected, and it may happen every year among the cluster of viruses that will cause seasonal flu and other respiratory syndromes. We are likely to see SARS-CoV-2 as part of this. So
Okay. All right. So
it's nothing. I don't think it's a new thing that is going to behave like we knew before, which will cause people to be severely hospitalized or sick or die, like we experienced some years ago.
Right. Thank you. If you just joined us, it's 17 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. My name is Nortey by nature. I'm in the company of the virologist. I've got Associate Professor J.H. Kofi Boni. He heads the Noguchi Department of Virology. And and he's here, and he's also he's the head of department and associate professor of virology. Then I have another virologist with the Kumasi Center for Collaborative Research into tropical medicine, Michael.
Yes, tropical medicine.
KCCR, but you're also part of or an extension of the Kwame Nkrumah University, right?
Yes.
Okay, so they've told us that, well, there's ongoing active integrated research surveillance of these influenza viruses, COVID being one of them, and that despite the de-escalation of the COVID pandemic way back 2020 and early 2021, we should be expecting that these things will pick up from time to time. Essentially, we are living with COVID, and they are perhaps concerned or will activate responses and give the appropriate communication should they monitor a certain pattern of spike. We're talking about coughs, flus, and so on and so forth. We'll get to look at the symptom profile they are concerned about, and if you are experiencing them, what you're supposed to do, right? Should you be panicking? Should you be isolating? Should you tell your boss you're not coming to work? And all those kinds of things that remind you of 2020. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook, YouTube, and X. And shortly, I will activate the phone line so you have the specialist to yourself, all right? And you can infect them with all your questions. Prof. Bonnie, let me come back to you. So, okay, we see these from time to time. The university has very, very commendable, very proactive, issued the communication and the cautionary measures. Okay, and we are told of a localized, at least in terms of their report, right? A localized resurgence, and the reference or the should I say the eye of the storm or the epicenter is the university campus. Okay, you and I know the university campus is spread out, and there's a lot of free access and mobility in and out. What should we understand? Though you've explained to us that it doesn't mean there are no cases anywhere else. What is the understanding when we hear a localized resurgence and then efforts or measures to contain this? To the layperson, it seems to suggest that, well, okay, we can keep you all UG, stay there, we'll manage this. What does it mean when we say localized?
So what it means is that within the university, they have one of the sites there, the sentinel sites.
All right, where they take measurements and data.
So they were just picking these samples, I'll say, influenza-like illness samples from patients who visit
these centers.
hospitals.
Right.
So they realized at some period that they were getting a lot of cases. So they became concerned. Okay. For sentinel sites, they
Can you just move the microphone slightly closer to you?
Yeah. For sentinel sites, they have a cap.
Okay.
Of number of samples that they are supposed to pick within a week.
All right.
That is during the peacetime.
So like a number upper limit.
Yes.
Okay.
So during peacetime, but in terms of outbreaks, then they have to make sure that they have to pick as number of, a large number, so that they can sample and know what is happening.
Okay.
So I think the Epi weeks 25 and 26, that is not the second week or the first and second week of June.
All right.
They realized that they were getting a lot of cases, a lot of suspected cases.
Okay.
And these suspected cases turned out to be both influenza and also SARS-CoV-2.
Okay.
Which
just clarify for my listeners.
Right.
So these are people who are experiencing symptoms and they present on a voluntary basis to a health facility, right?
These are people who are experiencing symptoms, that influenza-like symptoms.
Yeah.
You have fever, cough or sore throat, runny nose and all.
Understood, yeah. All right. So they presented. So let's say if I, Nortey, went to, let's say, Legon Hospital or any of the places, right, where they are taking and reporting their data.
Yes.
Right? So you're saying that there's been an increase, an observed and manifest increase in these centers,
right,
which triggered the concern.
Yes.
Okay, so these are not, it's not as if we've gone into town and we're randomly sampling people. These are people attending health facilities with complaints.
Yeah, they went there, they met the case definition for influenza-like illness.
They meet the criteria.
Yes, and the health staff will take their specimen and forward it to the testing lab for them to just find out what it was.
Okay.
So the testing lab realized that these 2 weeks that we're talking about, we were getting a number of suspected cases, and they were turning out to be positive
Okay.
for influenza and also SARS-CoV-2.
Right.
So that is why the university authorities started sending out cautionary notes
Okay.
that this is unusual, and it was unusual because if we are getting on the average within a day 15 cases in a week, but this week we are getting more than 100 samples, then you'll be
Clearly
alarmed.
something is amiss.
Yes.
Something is going
so
on.
so then
Right.
they have to then warn them that okay, people have to take precautions because what is happening is unusual.
Okay.
But I think it also coincided with some activities within campus.
Yeah.
But that is why even they more or less alerted. that,
Right.
Look, because of what is happening, let's all be careful
Okay.
and let's revisit some of the protocols that we used to
Okay.
engage in during the height of
Okay.
the COVID-19.
Let me just bell the cat. Sometimes we are cautious, but it's important to get a context. There have been hall weeks and mass attendance events
right.
within the time reference that Prof is talking about. Okay, many of these they bring in celebrities, the musical shows, and so on. Indeed, I listened to a clip where one student, in response to the cautionary measures, said they don't want us to enjoy the enjoyment on campus. So it is a lie. They are just saying this to get us to pipe down, right, and restrict the range of activities that we engage in. But again, like Prof is saying, right, and the data is also saying, around that same time, call it a correlation, a coincidence,
Right.
we had this spike. And as, should I say, responsible authorities and agencies, there had to be a communication and a commensurate response. Am I right, Prof?
You are right.
So that is specifically what the university has done, and that is what and why we're saying localized. This is where it was evidenced or manifest. Am I right, Prof?
Yes, you
Okay.
are correct.
So, folks, if you have any questions, WhatsApp is 055 1111 997. We're live on Facebook and YouTube. We're looking at understanding the recent localized resurgence. Well, I'm using that carefully because the context is important. I know people pick from us, and Prof is telling us, the two virologists are telling us, they monitor these things over time, right? And therefore, they can look at the pattern of influenza and other related diseases and, report on them and use those pieces of data to inform responses.
Yeah.
Yes, Prof.
So we can also talk, if you talk about resurgence, I mean, there's always supposed to be a driving force.
A driving force for the resurgence.
So if the virus strain that we are dealing with changes a little bit, or if we are having some waning immunity from the vaccines that we have taken and something is introduced, we are going to have this happening. So basically the kind of subvariant that we are having
Okay.
is highly transmissible.
Okay.
So if you have large gathering and people are showing symptoms, you can easily transmit it to others.
Okay.
So this is what was happening. So when they realized it, that look, we did a short time, so many people were coming down with these influenza-like illnesses, then I think it was the best thing they did. Let's sound a caution so that everybody will be on the lookout for. If somebody is sneezing, coughing, you make sure that you stay away from the person.
Right.
If it is possible, put on your respirator or what we call the face mask or the
Right.
nose mask, so that you just not get these infections. Because we don't know. Yes, we are saying that it's less severe,
Okay.
but we don't know what may it may cause in some other people
Okay.
who may have some other underlying health conditions.
Right. 27 minutes past the hour of 2 on Joy 99.7 FM. My name is Nortey by nature. I I pretend to host Ultimate Health, okay? But listen, every Sunday we try to bring you up-to-date information on health issues. If it impacts on your health, your well-being, we'll talk about it. We're experiencing a spike in COVID cases in a localized area of Accra, being the University of Ghana. There have been certain cautionary notices and communications, and I do believe commensurate response measures put in place by the university and also the health system and the health service. If you have any questions, concerns, WhatsApp is 055 1111 997. We're live on Facebook, YouTube, and X, right? Send your questions. My guests are in the studio, Professor J.H. Kofi Boni, Head of Virology at Noguchi, and Dr. Michael Owusu. He's with the KCCR in Kumasi. He's also a virologist and a researcher as well. They inform what we're doing. And I heard hints from Prof. Boni, and I'll toss it between the two of them, that, what we're seeing is a particular variant. The people who are, should I say, confirmed are manifesting mild symptoms. And therefore, I had it on my list of questions. But so, are we seeing the same thing? Is it the same, should I say, adversary that we fought with in 2020? Are there any notable changes? I know you do viral, is it assays and your PCRs and your what? What are we dealing with? Is anything changed?
Yeah, so we do what is called a sequencing to get to know.
Sequencing, that's the word.
Yeah, to get to know the strain that is circulating.
Okay.
So after it was done, we saw that it was the Omicron
that came later.
Yes.
Yeah.
That came later.
Right.
And it came with a particular subvariant.
Okay.
But we have seen that there has been some new variants that have been introduced that currently WHO is monitoring.
Okay.
In fact, it got introduced in India somewhere in February.
Okay.
So this new variant has been now introduced and they are monitoring. But what is about this new variant is that it's got less severe infections.
Okay.
I mean, less severe disease, severe disease or illness. And what is about it is highly transmissible.
Okay.
So it can easily be passed on from one person to the other.
Less severe, but it moves quickly from person to person.
So if one person is infected, get another person to get the infection is quite easy or very simple. If the person come close enough, the person either coughing or even speaking, you can pick up the viral aerosols and you can get infected. So that is what it's been seen. So yes, we can talk about we being concerned because of the high transmissibility.
Right.
But then, are we so concerned too about its severe form of illness? No.
Okay.
So yes, we are sounding out a word of caution, but we also know that we are dealing with an Omicron that we have had before.
Okay. Right. You also hinted, and folks, I'll read out your WhatsApp and other messages shortly. I need to cover quite some ground. That's the challenge being multimedia. You got all sorts of screens in your face, and you're supposed to balance all of them. Right. But let me come to you, Dr. Owusu in Kumasi. Prof hinted and said that, I'm trying to use his words, but he mentioned or hinted the consideration or the possibility of waning vaccine effect or cover. We have been jabbed, we have taken boosters, and it's supposed to protect us over a period. You both have confirmed that we should expect from time to time periodic or even seasonal spikes. Okay. Does this say anything to the kind of cover we believe we've given our populace, right? Even though we still are talking about the UG case. Does it speak to these things? He's brought it in, but does it speak to anything with regard to the efficacy of the vaccines and whether it's related to what we're seeing?
Yeah, so I think it's too early to talk about whether this particular variant we are seeing has effect on the efficacy of vaccines or not. I mean, if you look at the WHO classifications, they have classified these variants into about 3 categories. They have variants of concern.
Okay.
And the variants of concern is when you have a variant that has increased transmissibility,
okay,
can cause more severe disease,
okay,
and has reduced effectiveness of vaccines, treatments, or diagnostics. So in the early stages of COVID,
Doc, just a sec, can you go over those again? Because one I checked, which is what Prof. Boni has said, right?
Yeah.
So transmissibility.
High transmissibility.
So that is check.
Yes.
Confirmed in this case. Right.
Yeah, can cause severe disease. But you see, what we have, so Prof mentioned that it's called a variant under monitoring.
Okay.
So it hasn't yet become or hasn't reached the level of a variant of concern.
Okay.
If it becomes a variant of concern, then it's a high transmissibility and can cause severe disease and hospitalization and death.
But very worthy of monitoring.
Exactly.
We should be
And then
watching it. Yeah.
And it also has effects on vaccines in terms of even identifying the organism,
Right.
using diagnostics, offering treatment, and then putting in, assessing whether the vaccine has an impact or not.
Okay.
But then variants under monitoring are ones that we are gradually looking at the population to study,
Okay.
to see and understand whether it will cause any high risk impact on patients, on individuals
Okay.
or not. But I mean, for us, what is most important is that yes, there's a virus that has high level of transmissibility,
Okay.
which will mean that it's good that we put in place all the measures that we have written ourselves. I mean, some years ago, if you refer back to when COVID came, we have a 2020-2024 strategic plan.
Yeah.
And in this strategic plan, we had some goals that we set for ourselves as a country. One is that we were aiming to limit and stop importation of the virus.
Okay.
We wanted to slow down and manage community spread. We wanted to provide medical, psychosocial support.
That's right.
And we wanted to take active surveillance, community outbreak, community surveillance activities. And then, put in all measures, including behavioral patterns of changes that we hope to minimize through offering social and economic life support. But if you have monitored us, as a country, since COVID came in, a lot of the measures that were put in place, you don't find them. We learned a lot of lessons when COVID came.
Right.
Because we are people that we hardly will wash our hands. So we don't find Veronica bucket advantage places. When COVID came in, you saw that a lot of places now had Veronica buckets. Water was available.
Yep.
Hand sanitizers were installed at even at the universities, at entrances.
They're all
at
empty.
banks.
They're all empty now.
And you go to the market and people have alcohol sanitizers on themselves.
Right.
And people have soaps available for you to wash your hands. So these lessons that we learned, it was some of us, our hope and belief that it will become a part of our life, said that it will guide us, it will change our behavior. We will learn something that will be able to help prevent some of these wild infections, if possible. Protect us for long term to come. But if you look around, we have unlearned this gradually, whether consciously or unconsciously, and now trying to switch back to our old self, knowing very well that the world is not that free.
Right.
Today is COVID, but I even think that SARS-CoV-2 is a respiratory virus that is a bit friendly. But if you want to deal with other high-level pathogens, which are spread through body contact, the Ebolas and the Marburgs and all that, which they show no mercy. Once you interact and you will engage and you shake hands and you do all the, you have.
Doc Owusu, you sound as if you're waving the flag, ringing the bell, and saying we have become complacent. Is that exactly what you're saying?
Exactly, but we had a strategic plan that was guiding us.
Have we deviated from the plan? Because I'm listening to the reason I'm putting, and I'll bring it to Prof. Bonnie as well. We've heard the measures announced, right? It seems to most people, and you can confirm otherwise, that this seemed to pertain or be restricted to the University of Ghana campus.
Right.
Prof. Akoria of the Ghana Health Service has broadened this and said, look, we should all be vigilant and adopt or go back to these measures. Knowing the stubborn academy of the Ghanaian populace, is this what we need, or do we need firmer communication without triggering panic? Right? We're saying we haven't had any hospital admissions, but how are we going to get people, especially, I'm a psychologist, so behavioral change, go back to these churches, go back to these companies, workplaces, institutions. It sounds like we are not mobilized and motivated to do that.
Yeah, for me, that is the challenge. And we need to do something about this and make it a part of us. For instance, if you have respiratory disease, you are coughing and sneezing, you need to get a mask. Mm-hmm. Put on those masks. If possible, avoid visiting places, large gatherings, and concentrated areas, because you are infected and you are coughing and sneezing. But then, I mean, you don't do that. You just don't put on anything. You don't wash your hands. You have no sanitizer. You join the crowd. You cough, sneeze, and then you spread this for others.
Okay.
So, I mean, during COVID, I mean, a lot of communication went through. People were advised. Some of this have to be enforced. And I mean, with time, these are almost thrown around. You can look around almost every place. You don't find some of these measures, but these are cost effective.
Yeah.
And for me, I mean, it's the basic things that you have to do to prevent, whether it is Omicron or any wild strain you want to think
Okay.
about. Common things like washing hands, I mean, applying alcohol sanitizers, avoiding large gatherings, ensuring that you have good ventilation in your offices, lecture room, offices, staying home when you feel that you are sick or you are coughing or sneezing until you recover before you go back to the population.
Right.
And if we are guided by this, it's going to help us a lot. Not just, I mean, even for cholera, things like cholera outbreaks, for instance.
Right. Okay, Prof.
Washing of hands,
Yeah.
I mean, is something that can
Well-
help.
well
It has
understood.
helped to be able to reduce some of these
Right,
things.
well understood. Right, if you just join us, 39 minutes past the hour of 2 on Joy 99.7 FM. Ultimate Health is the program. We're talking about the recent spike in COVID-19 or SARS-CoV COVID-19 cases reported at the University of Ghana. A range of measures have been, should I say, triggered into action. I've got those who are very, very, very close to that action. In the studio, I have Professor Kofi Boni. He's a head of virology at Noguchi. And I have on Zoom as well Dr. Michael Owusu. He's with the KCCR of the Kwame Nkrumah University of Science and Technology. Right? They say NUSC when I was in university. Wasn't like that. So we've got the details, we've got the context, right? WhatsApp is 055 11 11 997. Send us your questions, your concerns. I'm going to be looking at the symptom profile. If you meet the criteria, what you should be doing, what we've been told, and then I'm going to weigh with my guests. I mean, Dr. Uso has already tiptoed into that. Whether the activation or the cautionary activation of these measures is, should I say, adequate. Okay, if the transmission is high, and you say, well, mass attendance gatherings, okay, people are being to church today as I speak, right? They are not on the university campus. So we want to weigh and see what really do the health authorities want us to be doing, right? Whilst those tracking, sequencing, and all those things, they do their stuff and inform the response. Prof. Bonnie, are we on the right track? I know we don't want to stop and disrupt work or academic calendars,
Yeah,
right?
so,
But
see,
so how should we
Nortey,
look at this?
We are talking about here, I mean, for purpose of this discussion, we are talking about localized resurgence.
Yes,
But it is not localized resurgence.
I'm happy you hear
In
to
fact,
hear you say that.
In fact, we have other regions reporting.
Thank you.
Other regions are reporting. So if the university has come up with a circular cautioning the community in the university and its environs, it's not for only us. I
Right.
think that the nation should take it up. Everybody, especially during the time that we are in this rainy season.
Okay.
We are going to have these influenza-like illnesses going up. Why don't we go back to what we know best? These protocols that we got so much adhered to.
Okay.
Be wearing the masks and staying away from huge gatherings that maybe if you don't have any business there, you don't go there.
Right.
And making sure that if somebody is sneezing, coughing, we just distance ourselves from that person. If you are not feeling well, don't go to work.
All right.
Get to the health facility, let them check you. And so if we keep doing these things and not forgetting the hand washing thing. I was talking to them and I was talking to some people. I was saying that look, this infectious disease will not leave us.
Right.
So simple things like personal hygiene, we shouldn't do away with it.
Joy
Hand washing should be a key thing that we should be
Okay.
doing all the time.
All right.
So I think that it shouldn't be for the university community alone. As a country, like what the DG actually said, we
Right.
should all be on the alert
Okay.
and start taking these precautions seriously.
Okay.
Making sure that those protocols that we are used to, it was not too far ago, I
Right.
mean 2 or 3 years
Yeah.
ago, we should revisit them and make sure that we put on the masks. We stay away from people who are obviously coughing and sneezing. We make sure that gatherings that we don't have to be there, don't let us go there, especially where there's so much crowding and all that. So when we do all these things, we tend not to, I mean, we certainly save ourselves from getting
That
some
will
of these
result, that will yield the dividend we're talking about. Control.
This is
Yep.
the effective control measure, the
Okay.
intervention that we can put
All
in
right.
place to more or less curtail the
Okay.
spread. And you see, Nortey, we have to also note that viruses tend to circulate among the human population.
Exactly.
And the more they circulate, the more they change in their structure.
Exactly.
And when they change, that's where we call the variant and the subvariant and all that.
Right.
They mutate. And when they mutate, they can go for severe or less severe or benign.
Right.
So if we are able to curtail spread, then we tend to stop the mutation
Right.
process.
Okay. 44 minutes past the hour of 2. Serious business, right? My specialists have specialized in virology. Okay, I specialized in human behavior. And I know the stubborn academy variant. Look, we had to restrict movement. We had to do certain things. We are happy that you're saying, well, it's not reached there. And what we're seeing is not as severe, but definitely it responds to the same, should I say, empirically proven methods.
Right.
So we should start observing them. Hotels have these sanitizer stations on the walls. Many of the hotels, these things are empty. You press them and there's koyo,
Yeah.
right? There's air.
Full of dust now.
Veronica, buckets and dispensers are empty.
Right.
They are not being filled up with water and so on and so forth. Those who did brisk business in masks and sanitizers realized that Charlie, they'd rather sell other things.
Yes.
Maybe no, I won't mention Indomie. Right. So, do we need a heavier hand to get this under control and reintegrated into our behavioral response? That's what I'm asking. I'm going to read out a couple of WhatsApp messages and come back for your responses, both of you. Right. Hayford in Bato says, please, those samples were taken before finding that they are affected by the virus. Are they not injected by the COVID vaccine? If yes, I would like to know how long the vaccines work in our system. So he brings up vaccine efficacy, and we've talked about that, but I'm sure my guest will bring that back. Hello, greetings, Nortey and Ultimate Health team. Please, we took all the vaccines. I knew this would be coming. Does it mean that was not effective? Please, you must listen carefully to our discussions, right? I make sure I bring the right guests and we ask the right questions. But I will ask this again. Please, are we preparing for another lockdown sooner or later? Concerned citizen. Oh, concerned citizen. The plenty talk we've talked. Okay, my guest will address that. Thanks for sharing. Oye Nafienya welcomes me to her home. I will come, Oye, in a mask. Okay, today I said I was coming in a mask, and then I charged. Look at the time and charged, and I'm here. I must say I was a bit gratified that Prof wasn't in a mask, but we are giving out the message. Please forgive us. Forgive us. I remember there was a billboard where I said Prof Akufo-Addo. The President Akufo-Addo was encouraging us to wear masks, and the billboard, he wasn't wearing a mask, and they had to quickly take down those billboards and put yeah, so we need to know how serious we are. Uncle Michael, are you still on the other side?
Yes.
Okay. I'm looking at, my area of specialization or focus or interest or concern. Behavioral change. Okay, there's something, we know it, we've identified it, we are still monitoring it. Indeed, my specialists confirm that the world is also monitoring it, right? So do we need a higher, stiffer, sterner message to trigger compliance, or is this okay? It looks like we are saying, oh, try and wear a mask, try not to go here, the funerals are happening there. It's not that serious, but how do we get this trickle down and behavioral change or readoption of positive protective behaviors?
Yeah, so before I come to that, I heard a number of people were asking whether they took the vaccine.
Yeah.
Is as if the vaccine not working. So the principle underlining the COVID vaccine is that the vaccine does not prevent infection. But what the vaccine does is to prevent having severe disease or possibility of dying.
Exactly.
This is what guys. So
Right.
you may take the vaccine, you may be infected, but because you have taken the vaccine, you may not suffer severe disease
Okay.
or may not likely die from this.
Right.
So it's possible that a number of the people who have had infection may have mild conditions because they already have some prior immunity. So the virus is not able to further break down their system to cause them to be hospitalized. So it's a good thing to have taken the vaccine.
Right.
And some of us are looking maybe in the near future, just like influenza vaccines are given in some developed countries every year. It's possible
Right.
that if this becomes a problem and you tend to have high transmissibility, then maybe you may be talking about annual boosters
Okay.
to be able to build people's immunity to the level where even if they become infected, they may not be hospitalized or they may not get sick.
Okay.
Then becomes part of things that you may have cold or sneezes, and then maybe you just take some fluids and then you are fine. So the vaccine was good, and never think that the vaccine we took is not working. It's working. This is why many people
It's
may
doing what
deny
it was supposed to do.
exactly.
Okay.
So talking about whether to have high-handedness in this, during COVID time, we had a setup called a risk communication team, which is still within the Ghana Health Service. There is a whole unit that is responsible for this. These units will work in coordination with media organizations, with regional directorates of the health services, and they are able to undertake good communications.
Okay.
I mean, they know what to talk about, they know what to inform. Some of them are able to interact with churches, schools on what they have to do to be able to limit spread and
It's
all
a
that.
very tough
And
job. Doc.
the media were strongly behind the
Yeah.
service during November, playing adverts on wash your hands, social distancing, and all that. So it's a whole mobilization force that you need to be able to inform the community if you want to have an effect or impact on behavior. You have mentioned Academy of Behavior. I mean, it's a difficult
Stubborn Academy. Indeed,
At
in
this level-
Jamestown, the risk communication team went there and they were telling them about COVID. Meaning it doesn't come to the sea folk and the fisher folk. So we are sanctified, we are protected. So we don't want to hear all these. So how do you communicate risk on the level you are speaking to the degree, right? I've listened and monitored all the statements. The Ghana Health Service, I said Ibeku is what?
It's also the public health
Public
director.
Health.
Yeah.
Public Health Directorate. I've monitored the university, everything. But I'm saying, look, we're looking at this and we say, well, it's mild, and even a mild disease costs you in terms of treatment. It's money. If you're doing sanitizers, it's money. So I'm looking at, I come to Pro Boni as well. But what level, is it the Ghana Health Service that's going to, issue a clarion call, or we think this will just burn itself out, have a natural progression, limited progression, and then we'll all go back to relaxing?
Well, maybe before Prof. Bonnie comes in, the strategy for dealing with some of these pandemics, it's not just at the level of the Ministry of Health. The Ghana Health Service is doing very well, and they lead these kind of activities,
Exactly.
but they cannot do it alone. So you have the interministerial committees which bring the ministries together, where the Ministry of Communication, Information, the roads, and all them sit around the table. This was led by high-level ministers, including the president, who can now give directives. And therefore, you have all the sector ministers supporting the health service in implementing and communicating this to people. And this is where we need to look at. This is supposed to be part of the strategic plan, because COVID is not out yet. It's only become endemic. And like we are all saying, the more you have increased transmissibility, there is a potential for new variants to emerge that may become a variant of concern. Which is where we don't want to get to. So you want to have a long-term strategy that tells us that, so in the next 10 to 20 years, how do we deal with potential threats from this? How do we strengthen our communication? So the same setup that was used earlier, it shouldn't be dismantled. The setup must be able to meet either annually or maybe half-yearly to look at the strategies, especially in terms of behavioral changes, and then mobilize all the sector ministries and tax them with what they used to do, so that they can support the communication, the media, and the campaigns and all that. And the focus must be on behavioral changes that will allow people to just adopt basic practices that they have to do to be able to prevent some of this. And maybe not before that again. You were saying that the disease is mild, but we also mentioned that sometimes these measures is not for those who are strong, but it's to protect the vulnerable. There could be sickle cell disease people. I mean, maybe 5% of them in the university. There could be people who have underlying conditions, hypertensives, chronic kidney diseases.
Exactly.
When they become exposed to the so-called mild, they may likely have severe disease. So these things is to protect this minority, and this is why we don't have to think of ourselves just ourselves. But we need to think of the elderly, the vulnerable groups, so that we don't do things that will jeopardize or put them in danger, and maybe cause them to suffer high risk.
All right. Thank you so much. That's Dr. Michael Owusu. He's with the KCCR, Kumasi Center for Collaborative Research into Tropical Diseases. In the studio, I have Professor J.H. Kofi Boni with Noguchi Memorial Institute of Medical Research. Prof, coming back, during COVID, I was so active. Some people said, Abba, why? You are bashing people, but it mobilized a lot of resources and a lot of action, right? What do you say? What should we be doing? Are we okay with what we've done? I remember during COVID, I was on all data sets, worldometer, whatever, looking at numbers. People thought it was a bit obsessive or frenzied, but we needed to get authorities to see that, hey, this is the case. And then we started having our addresses and all that. We're not at that level now.
Right.
Okay. Is it okay? Are we expecting to hear that, it has calmed down on UG and therefore any caution or alert is, should I say, de-escalated? What is the outlook? What are we expecting to see so that we can reassure Ghanaians in the localized, should I say, epicenter or elsewhere?
So whenever we are talking and we mention COVID, and we said during COVID, then some of us will say, okay, COVID never went away.
It never went away.
COVID, so, Mike said that it has now become endemic. Okay. We are living with it. So during the height
we never
of
said
that pandemic,
during malaria.
Yes.
So we accept that malaria is with us.
It's with us. So during the height of the pandemic, at the time, that's 2022 and thereabouts, the kind of measures that we put in place. I like what Michael said, because we have the NTCC, that is the National Technical Coordinating Council.
Right.
That brings together all stakeholders, including all the ministries.
Right.
And they more or less will have to come up and activate some of these things. And within that committee, we have the risk communication group.
Right. And
they will go, they are professional. They go out and make sure that they communicate, educate, they sensitize, and bring awareness for people to know that what we are talking about is not only a resurgence and we are just leaving it there.
Okay.
It's something that we want to let it become a culture.
Right.
Because you see, we are going to be having bouts of all these things from time to time.
Right.
We are having COVID. Mpox was not gone yet when COVID just came in.
Right.
We are still dealing with Mpox. We're asking people to wash their hands, people to observe some of these safety protocols. So it is not that we are going to wait for it to spiral or get out of before we start talking to people about it.
Right.
I know that the NTCC will meet and they will come up with some of these cautionary messages and make sure that people will just follow through.
Okay.
They will adhere to them, because if you don't do that, it is not for those who are strong. Michael said it.
Yeah.
Sometimes the people who we don't expect most will be the one who will be at the losing end.
Right.
So we'll make sure that
so we are still concerned about those with underlying vulnerabilities.
Apart from that, we can talk about the pregnant women, we can talk about children, they are the vulnerable group.
Good.
So we'll make sure that these things come up and people are well educated to make sure they go back to those protocols that we used to adhere to and start just observing them. In fact, if we don't even do anything at all, the masks and hand washing should be.
It's within reach. We should do that.
Yeah.
Okay. Now, Prof. Boni, over the period, especially because we have life and we can breathe, people have been bashing vaccines and all sorts of back and forth. And I do know and do expect, again, behavioral, right? That with a spike like this, people get the chance to ask the questions that we're hearing. Now, oh, we took all the vaccines. You people said, is it that they were? Some people say, oh, they were lying. It's not an area I like getting into because sometimes it's difficult to moderate it. But what do you say? I mean, Michael has said it succinctly that look, the reason people are not getting to the levels we saw in other countries, right, is because of that intervention. So you actually do have cover. Is it the case that we miscommunicated, or people, Africans like cure, they don't like management, right? Is it that the job of the vaccines was miscommunicated or distorted deliberately or otherwise?
I think the communication during the time was very clear that
Right.
the vaccines that were taken was not to more or less inactivate the virus in us. It was to forestall severe disease.
Right.
And that one was so clearly communicated. And vaccines will wane with time. Especially the COVID-19 vaccines that we took. So if we are having spikes now, and people are saying that, oh, we took some vaccines some time ago, so we think that we may be free from that. What we have to know is that then if you are having spikes, it could be driven by new variants.
Yeah.
And the new variants may not necessarily be covered by the vaccines that we took. So we need boosters from time to time, as we were doing before we stopped. I mean, that's 2022, 2020. We were
Right.
taking boosters even with during the time that we're having the incidents going down.
Right.
We're still taking boosters. So if we are asked to go and take vaccines again now, I don't think it will be out of place.
Okay.
And the vaccines for COVID is just to make sure that we don't get severe disease.
Right.
It is not to inactivate viruses in us or to kill the viruses that we are scared of. That is the SARS-CoV-2 viruses. So that also should be communicated clearly to people
Thank
to
you.
understand.
Right.
So they shouldn't be with the notion that, oh, we took some vaccines, so we are okay. Anytime we have spikes, that means they get driven by possibly new variants or new subvariants. So we will need to have boosters.
Okay.
We need to have boosters.
Okay. Right. Lastly, Prof, we're already out of time. It's 3:00. But for those who might be experiencing the cluster of symptoms, can we just hit on the cluster of symptoms and what you would want them to do by way of response? Having already emphasized that we need to reactivate these protective measures, distancing, hand washing, masks, and all that. Those who experience which cardinal, should I say, symptoms, and what should they be doing?
So influenza-like symptoms are so clear.
Right.
You have the fever.
Fever.
That is, your body temperature will go beyond
Right.
37. Then you have either sore throat or cough.
Right. So throat or cough.
Those are the clear ones that will start. The sore throat will start developing. So when you start having symptoms like that, before even you get to the runny nose, you have to make sure that you report,
Okay.
or make sure that you get some medication.
Okay.
People
Report at
usually,
a facility.
yes, go to any health facility for your sample to be taken.
Okay.
Usually we have health facilities dotted around the country that are engaged in this influenza like
When you say have your sample taken, I mean at the peak of our challenge,
Right.
That became quite an expensive enterprise.
right.
For some people, we're going to Noguchi, we're going here. That suggests that people have to go and test,
Yes.
right?
Yes.
It's not a doctor requesting that you test. You must go and test, or how do we do that?
You have to test, and it comes with a cost, like you are saying.
Right. There are some kits that are a bit more friendly, but I want to break it down so listeners understand what the response portfolio should be. So if you have these things present at the facility, are they going to ask you to test, or should you go?
If you go to the Sentinel surveillance sites, that one they are taking it under Ghana Health Service,
Okay.
and that one is not paid for. But if you are walking into some of the research institutions that you want to test yourself, that is a different thing. That one they are going to test and maybe possibly collect money from you.
Okay.
But if your sample is part of the Sentinel surveillance activities that the health service is organizing,
All right.
having now, that one they will take it and they will take it to the center that they do the normal testing, and then that one will be at no cost.
Okay.
Yeah.
All right. I can confidently say that Ultimate Health is here as we were during the should I say pandemic days.
During the height of the pandemic.
Yes,
yeah.
if there's anything that we need to communicate, just let us know. We'll partner with the agencies to make sure that the populace get the right information, and we can also monitor, compliance and other things. That's what we can do at this end. But thank you so much, Professor JH. I saw the Humphrey, and the J was what?
Joseph Humphrey Kofi Bonny.
Joseph Humphrey. He sent me the full. I always knew Kofi Bonny. Well, of course, he went to advancement. Not so.
That's correct.
He went to advancement. All right. Uncle Mike, are you there?
Yes, I'm there, Nortey.
Thank you so much. And like I said, you guys are family. If there's anything we need to articulate and bring out to the masses, Ultimate Health is always your number one to carry that across, right? So that we don't miss anything, and we partner with you to save lives. Thank you so much, Dr. Michael Owusu from KCCR. And one of these days you have to. I think I have to find Ziggy. We find money and fly Prof in. We've never had him in the studio, but he's always so.
No, when he comes to Accra, I'll bring him here.
Okay.
I'll bring him.
All right. I intentionally did not ask if there's anything happening by way of spikes in Kumasi, but since you haven't mentioned it, I shall presume that you are in good standing.
Yeah, Kumasi is in good standing.
All right. Thank you so much. We are always blessed to have you guys. This one just says, good afternoon, sir, and resource persons. Please, thank you for the enlightenment. Please, most Veronica buckets have now assumed the role of dustbins in most places. It's empirical. It's factual, right? If you have a company, a church, a business that has these things, please reactivate them, and let's make sure this stays within manageable, should I say, proportions or degrees, so that we don't have to get to any troubling zones. Thank you once again, Prof. Bonny, Dr. Owusu, and of course my discerning listeners. Thank you, Ziggy, my producer, and probably next week I'll come in a mask to demonstrate. Stick and stay on Joy 99.7 FM. Ziggy will come and give you some cool music, which is also a kind of a vaccine, right? On a Sunday afternoon. Stick and stay. Don't go away. My name is Nortey by nature. Thank you.